Hypertension or high blood pressure affects millions worldwide and is one of the leading risk factors of heart disease, stroke, and also kidney failure. What makes it especially dangerous that it often develops without noticeable symptoms, earning its name as a silent killer. Early identification and timely management are key to preventing long term complications. So, in this session, Dr. K.S. Chhajer will explain us that how to recognize some early warnings, understand the underlying risk, and explore simple yet effective ways to keep your blood pressure under control through lifestyles, then awareness, and when needed, medical interventions. Dr. Chhajer is highly respected consultant diabetologist, holds an MD along with a diploma in diabetes, and brings with him years of experience in the field of diabetes and lifestyle related disorders, including hypertension. His clinical approach focuses not just on the treatment but also on the prevention, patient education, and long term health management. Through his compassionate care and evidence based approach and practice, Dr. Chhajer has helped countless patients take control of chronic conditions like high blood pressure and lead healthier lives. So we are honored to have him with us today to shed light on importance of early detection and timely management of hypertension. So with this, before starting the conversation, doctor, would you like to add something from your end?
No, no, you can just start.
Okay, sure. So we'll start with the conversation, doctor. My first question is hypertension is often known as a silent killer. So, why it is, and how can someone know if they are at the risk without obvious symptoms?
Okay, definitely hypertension is known as a silent killer because it produces usually no symptoms. Since there is no symptoms, so patient will not go to the doctor and but it will go on producing the damage in the organs. So even if the patient is not diagnosed and patient is having high BP, he will have the target organ damage. Main damage occur either to the cardiovascular system in the form of the heart attack or other cardiovascular disease, or it may affect the kidney, it may affect the eyes, and worst part, it may create the stroke, which makes life very miserable. So it is known as a silent killer because there is no symptoms, but it will go on damaging your organ, and sometimes patient only comes when they have developed some event like they have developed the heart attack or they have developed some kidney damage or some eye problem or stroke, and then only we know that yes, patient was having hypertension from last many years. So that is the reason it is known as the silent killer. Now next your question part is that how the patient can know without obvious symptoms. Naturally, once there is no
Yes.
symptoms, there is no clear-cut way to know it. But that is only way is that the patient should go for regular checkup, and the patient should pay attention to the minor symptoms, especially if they are obese or high risk patients having high stress. Then even minor symptoms like morning headache, sometimes dizziness, sometimes nosebleed, and sometimes even fatigue. These may be signs of the hypertension. Otherwise, there is no very clear cut signs. That is the reason it is known as a silent killer. So only proper medical
Yes.
examination will tell the patient whether they are hypertensive or not. So they should go for a routine checkup definitely.
Okay, so the screening is very important, and if it is not treated in time, then the other organ damage can happen, right?
Right.
Okay. So, doctor, my next question is what are the most common lifestyle habits or medical conditions that lead to high blood pressure, especially in younger individuals or population?
Now we are proud that we are having younger population than other developed countries. But another harsh reality is also that our younger population is getting more and more metabolic related disease. And among these is also the cardiovascular disease. And hypertension is very common. Now it is estimated that in our country, especially in the urban setting, almost 20 to 25% adult population is suffering from the hypertension. The main reason for this is the one is the obesity. Obesity is increasing, and now the prevalence of the obesity is again in India is almost more than 25% in the urban population. Another sad fact is that young age obesity, that is the persons between 5 to 19 years, are getting more and more obese. And almost we can estimate that near 1 crore people in our country aged between 5 to 19 years who are obese. So definitely it will going to affect their further metabolic diseases in the future. So one very important factor is the obesity. Obesity is also increasing due to in physical inactivity. In schools, there is now no physical activity in most of the schools. Again, the mobile and these laptops, they have also probably make children more vulnerable to the obesity because there is lack of the
Yes.
physical activity. Another very important factor is the unhealthy diet. Now, ready-made food, whether it may be Swiggy or Zomato, most of the busy persons prefer to eat these foods. Lot of the junk food is there. Our salt intake has increased tremendously. For a healthy diet, 4 gram or 4.5 gram salt is enough, which we use in the cooking. But in India, by one estimate, nowadays we are consuming almost 12.5 gram of the salt per day. Either we are taking as a raw salt, and it is a common misbelief in the people that probably black salt or sendha namak is less harmful or pink salt is
Yes,
more
yes.
healthy. But medically, it is nothing like that. Their sodium content is almost equal. Flavor and color may be different. So medical harm is equal. So number one is the obesity. Number two is the unhealthy diet. Another important factor, fat has increased in our diet tremendously because processed food they use a lot of the trans fats, and this saturated fat is very bad for the health. Third very important factor is the stress. Right from our now young age, persons are living under stress. Even in the young people or young students, we put them constantly under stress. Performance anxieties in the school, performance anxieties in the office, then the other social anxieties are constantly our part of our life. And this stress is very important to produce the cardiovascular disease. So it is very important that obesity, stress management, and regular physical activity should be done. Another important factor, consumption of the alcohol, cigarette smoking, which is also getting day by day more and more in spite of the so many taxes and these things. That it also creates the hypertension. Then sometimes other organ related disease, for example, if the patient is suffering from thyroid disease or kidney disease or some adrenal disease, then they may also develop the hypertension in the younger age group. And another very important factor is definitely genetics, which we cannot change. But we can, even if we are genetically prone and we are living in a healthy lifestyle, we can postpone the complications for many years. So these are the important factors for the young hypertensive in India.
Yes, thank you, doctor. As the lifestyle habits are in our hands, so we can obviously prevent ourselves or we can postpone some this kind of medical conditions, right? Also, thank you for that telling about the myth about the salt, also that pink salt, rock salt, and the normal salt. It's very important to know us about it. With this, doctor, my next question is, if we consider about the checking point of view, so how frequently should one check their blood pressure, and at what reading should someone seek medical attention?
There is no blanket rule that when we should check the hypertension, but in the young patients who are otherwise healthy and having no other risk factor, for example, if they are not obese, they are physically active, they are non-smoker, so then you can go checking for every 2 to 5 years, especially between age of the young age, that is the 18 to the 40 years of the age. But if you are having some risk factor like genetics, your parents or first generation relatives are the hypertensive or diabetic or other metabolic disease, or if you are obese, smoker, alcohol, you are in a profession with the high stress, very low physical activity, then you should definitely go for the annual checkup. Now, when to treat? Most of the
Yes.
guidelines agree that BP below 120 by 80 is the normal and there is no need to treat them. BP above 130 90 or 130 80 and up to 140 90 is the borderline in which the patient are usually explained that they should regularly monitor, and if repeatedly crosses the 140 by 90 then they should definitely be treated. Overall, we assume this that on a single reading we will not start the treatment because sometimes if the patient comes in the doctor's chambers, if they are stressed, then we will not going to start the treatment even with the slightly higher BP. Then we ask them to monitor. Another very important question is how to monitor the BP in the home because nowadays electronic instrument is available in so many houses. But if you don't use them properly, then it gives a false reading. So there are some simple rules. You should not take BP once you are stressed or once you are physically exhausted. You should be comfortable for at least half an hour. You should be without food and drinks for again half an hour. BP should always be taken in the sitting position, your legs resting on the floor. So you can sit on some chair and then your legs can rest on the floor or foot can rest on the floor. And then you can take the BP. It is better at the home to take the BP in both arms and then you can take an average. So mistake will be minimum. So now at what BP you should get a medical attention. As I told you, if it is repeatedly above 140/90, you should go to your doctor. But if a single reading comes above 180, सिस्टोलिक बीपी जिसको ऊपर वाला बीपी बोलते हैं और 120 डायस्टोलिक जिसको नीचे वाला बीपी बोलते हैं,
जी.
then it is a medical emergency and then you should immediately contact the doctor. There should be no negligence on this part because this BP can suddenly create a lot of the complications.
Yes, definitely, doctor. So, as we were talking about some diet, exercise, and lifestyle changes, so is medication always necessary to manage hypertension if we twist this point as a part of managing hypertension? So, is medication always necessary to manage hypertension, or can be controlled through this diet, lifestyle changes, and exercises alone?
That will depend on patient's profile. For example, if the patient is mildly hypertensive or slightly elevated BP, and he is able to follow the good lifestyle, then things sometimes can be controlled without medications. But in our practice, we see that good to follow a good lifestyle is almost like to follow a good religion. Everyone knows is that what is a good dharma, but no one is able to follow them. So everyone knows that what is the good lifestyle, but no one is able to follow them. A smoker knows that smoking is not good for health. A alcoholic knows alcohol is not good for health. And junk food taker also know that thing, but usually they are not following. So if naturally they are not following, then the things will not be controlled by the lifestyle management alone. But if a person is honest enough and is honestly following the good lifestyle and BP is mildly enlarged, then usually we prefer to wait for 4 to 6 weeks. If it is controlled by good lifestyle management, then we will not start the medications. Otherwise, medications will be required. But our fact is that people are not able to control the weight. Most of the obese patients are not able to set their weight because there is this binge eating. If they follow the diet for the 5 days, on the sixth day they will take a lot of the food. Salt restriction is day by day very difficult because all the you see the preserved food or packaged food contains a good amount of the salt. And exercise,
Yes.
whatever you request made, you do 30 minutes walking or whatever is possible. Most of the people, especially in the urban setting, are not able to do this. So that is the only point. If they religiously follow that lifestyle, if BP is well controlled, we can wait. But if the patient is somehow not able to follow a healthy lifestyle, then at least he should start the treatment so he can prevent the organ damage and he will not suffer further serious complication in the life.
Okay, so the if the hypertension is mild, then we can change it or prevent it ourselves from the lifestyle modifications. And if it goes severe or stage wise, then the medical treatment it will be as per as the stages of the hypertension, right? So, doctor, with this, what are some practical tips or daily habits you recommend for people already diagnosed with hypertension to prevent further complications?
Yes. First thing is diet. सबसे पहले खाना. So if their diet is healthy, it makes a lot of the difference. Patients should consume low sodium diet rich in the potassium if they are not suffering from the kidney disease. If those patients who are having kidney disease, then sometimes their doctor may allow low potassium diet or they recommend low potassium diet. But otherwise, in a normal person, we will want a good amount of the fruits and vegetables, low sodium diet, and low fat diet and avoid the processed food and take a good amount of the vegetables. Number two, physical tip is that they should go for regular exercise. At least 30 minutes walking for at least 5 days in a week, or you can say 10,000 steps or even 7,000 to 10,000 steps per day may be enough to maintain a good health. Third important thing is the stress management. We should know that once we are home, we should not come with our office or clinic at the home. We should be relaxed at the home, and that is the most important problem. Persons which I see working in the corporate sector, they always keep their office in their brain, even at the home or even whatever the place may be. So you should know the stress management properly. Another important thing is the consumption of the alcohol should be very moderation. If even alcohol is taken, small amount may not be harmful, but its amount should never exceed more than 90 ml, and it should never be consumed with the snacks, because again snacks will having a good amount of the fat and salt. Another important thing is the sleep hygiene. Good sleep always creates a good health, because sleep is the time when our brain rests, our heart rests, our pulse rate drops, our BP drops. So heart is having the least load. So good sleep is also very important to prevent the further complication. Another important thing is that if your doctor has prescribed the medications, try to take as prescribed by him, and try to take them as a regular time. And above all, try to monitor your BP. If it is well controlled, then it is okay. If it is not well controlled, again consult your doctor. So your BP can be kept below 130 by 80. So you can prevent the further complications. These are few very simple things which any person can do.
Yes, doctor. So I guess first the acceptance thing is more important, and also clearing the myth that younger population don't have this diabetes or hypertension kind of things. It's an elderly disease. So first of all, the I guess acceptance is a one thing, and then obviously the lifestyle modifications is in our hand to prevent ourselves from this long term diseases or the conditions, right? So, as we come to end of today's session on hypertension, identification and timely management, a heartfelt thank to Dr. K.S. Chhajer for sharing his valuable insights and breaking down such a critical yet often overlooked health concern. His guidance on early detection, lifestyle changes, and proactive blood pressure management has been truly enlightening. To all our viewers, thank you for joining with us. We hope these sessions had helped you to understand that managing hypertension isn't just about the number or the monitor, but it's about the consistent self-care, regular checkups, and making small but powerful changes every day. So stay tuned for more health focused discussion with leading experts. Until next time, take care, stay informed, and don't forget to follow us on social media for more updates, tips, and upcoming sessions. Dr. Chhajer, once again, thank you so much for joining with us
Thank
and
you very
sharing
much.
your knowledge.
Thank you so much.